Good morning. Good morning. My name's Kathy Scullen. I'm the Vice President of Marketing and Public Relations for the Crozier Keystone Health System. We have 5 hospitals in Delaware County, and we're pleased to be with you today. Crozier Keystone is very pleased to be here to talk about the excellent work on behalf of Representative Adolph and our legislators, including Senator Dominic Pileggi, in their quest to help restore some of the cuts to the proposed budget for Health and Human Services. Not-for-profits provide very important services to members of our community throughout the Commonwealth. Hospitals like Crozier Keystone Health System are some of the largest employers in our communities. We provide family-sustaining jobs and wages. These are challenging times, to be sure. But thanks to Representative Adolph and Senator Pileggi and those assembled behind us today, Health and Human Services providers throughout the Commonwealth can continue to provide the many services that are needed to our constituents. It's now my pleasure to introduce some of our Health and Human Services colleagues. Next on our agenda is the President of the Hospital and Health System Association of Pennsylvania, Carolyn Scanlon. Carolyn?
Good morning, everybody. I want to join Kathy and others who are here to say that the hospitals of Pennsylvania are grateful that within a very fiscally constrained budget, the legislators, led by Representative Adolph, Senator Corman, and other leaders of both houses, understood the importance of maintaining financially stable hospitals. We stand for healing, health, and hope in all Pennsylvania communities. And as you all know, we take care of our constituents, your constituents, from birth to death. And so the budget allows us to take care of mothers and newborns, allows full funding for burn centers, trauma centers, small hospitals, continued training of doctors, and it allows hospitals to remain the economic anchors in the communities across the state. We employ directly and indirectly 600,000 individuals, which is very important in this economic climate, and we contribute $100 billion back into the community. We're key partners with others who are here today and in the communities in service of support of other community resources, including public school systems. We're educators of future healthcare workers for all providers, and we're the safety net of last resort for those in need. So we thank, again, Representative Adolph, the other legislators standing behind us, in investing in the state investment in these significant and important resources.
Thank you, Carolyn. And now we have another important member of the Health and Human Services Committee that I'd like to introduce to you next, Brenda Lloyd of Mechanicsburg from the United Methodist Home for Children. Brenda?
Hi, I'm Brenda Lloyd. I'm the Executive Director of the United Methodist Home for Children, which is a residential care facility, a community-based residential care facility that provides safe housing, counseling, care, and supervision for children and adolescents from the child welfare system. The children and adolescents in our program have suffered from severe neglect, as well as physical, emotional, and sexual abuse. The past few years have presented numerous challenges to agencies such as mine. Funding has been flatlined, mandates have increased, and there's been an increased pressure to quickly move children through out-of-home placements before they have had an adequate time to heal from their emotional wounds. And all of those things have caused the demise of numerous group homes and residential care facilities in Pennsylvania. As these resources decline, the child welfare system and our ability to provide services also declines. However, on behalf of all the children, youth, and families who work and receive services in the child welfare sector, from the public county agencies as well as private provider agencies like United Methodist Home for Children, I am pleased to see that funding for the county child welfare services has increased by approximately $45 million, which is very close to the 210 funding level. On behalf of all of those individuals, I would like to thank the House of Representatives and the Senate, those folks behind us, as well, and in particular, Representative Bill Adolph, Representative Jean DiGirolamo, Senator Dominic Pileggi, Senator Pat Vance, who she is our senator, and she's been extremely supportive of our program for many years, and Senator Jake Corman for their efforts to lead the fight to protect the funding and limit the block grant proposal for human services. We look forward to working with the legislature in the months ahead. We hope to be able to address how these funds are spent and how to best provide the services for the children and youth of Pennsylvania. Thank you.
Thank you, Brenda. And now it's my pleasure to introduce State Representative Bill Adolph, the chairman of our House Appropriations Committee. Health and Human Services need to have open and honest dialogue with their legislators, and that's what Bill is all about. He's always been a friend, always had an open door, and it's my pleasure and distinct honor to introduce him this morning. Bill?
Good morning, everyone. Certainly nice to be here in Harrisburg on a Saturday, June 30th. I'm proud to stand by my colleagues that have supported the funding programs year in and year out. I happen to have the voice at the budget table during the negotiations, but I can assure each and every one of you that my colleagues that are standing behind me and those that are on the floor right now, certainly one of our #1 issues was the restoration of the human services. In these economic times, it's very difficult to provide the necessary funding for everyone, for all the needs that are out there. What this budget did, it tried to sustain the expenses versus the revenue that we're collecting. I think everyone in Pennsylvania respects that. But by doing that, we are able to restore $84 million in human services for our most vulnerable citizens. We would like to have done more. I said on the floor of the House that this was not a perfect budget. Didn't solve all our problems here in Pennsylvania. But we accomplished some things this year that has never been accomplished before. And it's because of my colleagues standing behind me that pushed and pushed for some of these funding changes. We are now going to provide funding for over 1,100 individuals that are on the waiting list. $17 million. I believe it's the first time that we've ever provided for that type of money for these folks. Kathy Scullin probably can talk a little bit more about the rate adjustment factor. But that saved our hospitals $12 million. Our trauma centers, additional funding. Our nursing homes, additional funding. So you can point to one line in the budget and say, you know, we didn't accomplish everything. But it isn't because we didn't try, isn't because we didn't want to. It's because we had to live within our means. Those people on the waiting list have saved this Commonwealth, our county governments, hundreds and hundreds of thousands of dollars because those families have been taking care of their children. Some of these adults now are in their late 80s and 90s taking care of their sons and daughters that are 55 years of age. And we want to give them a peace of mind that their children will be taken care of after they're gone. So this is a compassionate budget, and we put this together in mind when we were trying to balance the budget. As revenues got better during February through June, we were able to do that. It was not magic. I don't know what we would have done if the revenues didn't improve, quite frankly. Slowly but surely, we're coming out of the worst recession since the Great Depression. I think it's important to remember that we're still only collecting revenues at the 2008-2009 rate. So I'm proud to stand by the human service providers. I want to again thank them for what they do for our friends, our relatives, our neighbors in providing these type of services. Pennsylvania probably has one of the best providers community in the nation. We provide over $2.6 billion in state tax dollars to fund these providers, and we will continue to do our best. I want to thank the legislators behind me. They're from all different parts of the Commonwealth, Northeast, Central Pennsylvania, Southwest, and of course, Southeast Pennsylvania. But we had one common goal, to provide enough funding for our neediest citizens. So I want to thank you. We'll always be there for you. As our economy comes out, I promise you that we will make sure that this money gets to those that need it the most. Thank you. Anyone? Tom Merck? Yeah, Tom Merck. Mr. Wade.
Good morning, and thank you very much for coming today to the Capitol. I just wanted to expand upon something that Chairman Adolph mentioned, and that is the specific line having to do with the waiting list. We put in $17.8 million for this waiting list initiative this year, and this kind of funding is unprecedented. And I think that maybe the best way to depict what populations that we're talking about here is with a story. And Representative Adolph did mention about the elderly parents in the Commonwealth of Pennsylvania, some well into their 80s and 90s, that are caring for an adult child at home with intellectual disability. And the adult child might be 60 or 70 years old. And these types of family situations exist in every district across the Commonwealth. The other population that the waiting list refers to are young men and women who are graduating from school, from high school, or are aging out of the public school system at the age of 21, who leave their formal education and literally have no opportunities awaiting them, whether it's training or some sort of employment opportunity or what have you. But those types of opportunities are now being provided with this $17.8 million appropriation in the budget. So Chairman Adolph is not taking credit for that. None of us are taking credit. We feel like this is our mission and this is our responsibility. And this is a very vulnerable population, and we are very, very happy to have been able to work to this end. So just again, I just want to underscore how important it is to care for these adults with special needs, and we're going to continue this mission for next year. So thank you very much.
Thank you very much. I'd like to introduce some of the legislators we have behind us. Kathy Watson, Rosemary Brown, Linda Colvert, Scott Petrie, Nick Miccarelli, Margaret Quinn, Kurt Masser, Steve Barrar, Kate Harper, Tom Mert, Tom Killian, Todd Stevens, Marcy Topol, and Joe Hackett. There's some of the legislators that were able to extricate themselves out of caucus and meetings this morning to be with all of us today. We appreciate it as the Health and Human Services providers for the Commonwealth. Again, dialogue is very, very important. We feel pleased that we have such great ears to listen to us during these very challenging times. I'd now like to introduce two more members of the Health and Human Services community here in our Commonwealth. It's my pleasure to introduce to you this morning Bill Schultz from the United Cerebral Palsy of Pennsylvania Association. Bill?
Hi, my name is Bill Schultz. I'm the booth president of the United Cerebral Palsy of Pennsylvania. I am here today to thank both chambers for hearing our concerns and Representative Jeremiah for holding hearings on the issues affecting the provider community, advocates, and affected individuals and families. Increases in harm and community-based services will ensure sufficient funding for individuals with disabilities and senior citizens currently receiving services, while the intellectual disability services waiting lists initiative will afford services to additional families. We appreciate the restoration of 10% of human services funding and modifications of the block grant implementation. Thank you very much.
Thank you, Bill. As you can see, it takes a lot of courage, emotion, and dedication to come up here and talk on the behalf of Health and Human Services providers. But I think you get to understand very, very quickly that these are really very emotional issues for all of our not-for-profits and our Health and Human Service provider community. And that's why we're here today, to express our thanks for helping to reinvest in the many services we provide to residents throughout the Commonwealth. And next, I'd like to introduce Marianne Bellasorte from Pathways, PA. Marianne?
Hi, everyone. My name is Marianne Bellasorte. I'm the Senior Director of Policy at Pathways, PA. Pathways, PA is about to enter its 35th year of service to Delaware County and to the greater Philadelphia community. We serve 6,000 women, children, and families every year through a diverse set of programs, including social services, residential services, financial literacy, adult literacy, and advocacy on behalf of our clients. So on behalf of Pathways PA and our clients, I would really like to thank all of our legislature for their hard work and dedication on this budget. None of us, and I know that includes the legislature, thinks this is a perfect budget, but I know that it could have been much, much worse. The pragmatic leadership of the legislators behind me has really led to Pennsylvania beginning the new fiscal year in a far better place than we imagined back in February. And I have to say that in all of my years of working with the legislature, this has been the most responsive, the best that they have ever been as far as really reaching back out to us to see what was possible with the funding that was available. Now, as we all know, in the end, the work of state government is never over. I think everyone in this room here on a Saturday probably knows that best of all. Today is definitely a day to celebrate the passage of the budget, but there are certainly longer conversations to be had about issues such as funding earned income tax credit outreach and funding general assistance. And again, I know the legislators behind me have worked very hard on those issues and on all of the issues, to the point where I had people calling me on Thursday saying that they were hearing directly from legislators in response to their emails, even as the budget was going on. So we know from our experience that our legislators are ready and willing to have these conversations and will do everything they can. And I look forward very much to continuing the conversations and continuing the work of making sure that all Pennsylvanians are being best served. Thank you so much.
So thank you very much for coming out today to hearing from the Health and Human Services community as we stand together, unified, looking forward to facing the challenges together that lay ahead and being able to go into the communities we serve and provide the highest quality services with the biggest hearts and the ability to care and to continue our conversations with the legislators that represent our constituents throughout the Commonwealth of Pennsylvania. That concludes today's press conference. We'd be happy to open it up for any questions. Thank you very much.